Okay, so today I'm speaking with Dr. Callisia Clarke, and she was the chair of the program committee for the recent annual SSO meeting. But today I want to talk about a number of the new events that occurred. So, for instance, can you tell us about the session that was made specifically for residents and even people below them? So you want to be a surgical oncologist.
Well, I think one of the most amazing things about the SSO meeting in the past several years is just the level of engagement that we've had from medical students and residents who come to the meetings because they're planning on entering the field of surgical oncology. And this year, we really wanted to specifically focus on that group and really try to provide them with some content that was very specific to them and met us a need. We had tremendous interest in the session. It was an overflowing room. And here we just imparted to them a little bit of the hidden curriculum about what it takes to be a competitive applicant for breast surgical oncology fellowship and complex general surgical oncology fellowship, what the fellowships look like during your training, and then what the job market looks like a little bit when you're done. I think the session was really well received, and we're definitely planning on keeping this as a part of our offerings moving forward.
So let's switch to another topic. Another session was leading outside the OR. How was that received, and what went into that?
So we first introduced the leading outside of the OR session last year. We did a single session with Dr. Margaret Shoup that was very, very well received. What we were hearing from our SSO members were that many of them, especially as they advance in their careers, were looking for opportunities for leadership, and that they weren't necessarily getting information on how they could capitalize on these opportunities or even find these opportunities at their home institutions. So we felt that that was very in line with the offerings of the SSO. We have a tremendous wealth of leaders in the SSO and in the SSO leadership. And so we were able to expand the offerings this year. We had 3 sessions. We had one that was focused primarily on leading in the executive suite in hybrid and non-academic hospital systems and what that experience was like with Tom Aloya. We had Dr. Pisters from MD Anderson talk about leading a major cancer center and all the nuances about that. And then we also had Dr. Zeiger, who has done a tremendous amount of work at the NIH supporting the NCI and the research efforts of the NCI, who talked to us about how to lead in the research space outside of the traditional, R01, your independent labs, just finding a space in leadership administratively that may not be as evident at your home institution. Again, we had tremendous attendance at those sessions, and the feedback was overwhelmingly positive.
Yeah, I agree. This was a really nice addition to our annual meeting. And my last question for you is, what do you think the most popular part of the meeting was?
Well, I think going back to social media, there were several highlights. I think the most persistent theme was that people really enjoyed the opportunities for connection, meeting with mentors, sponsors, getting advice from other faculty members, meeting peers, residents and fellows sort of interacting with each other. I think the sense of community at the meeting was very strong, and that was a theme throughout the entire meeting and subsequently. The debates are always a big hit. The great debates featuring leaders in the fields, having a little bit of fun, but also discussing some topics that are quite controversial that everybody's trying to figure out which way do we land on this particular topic. Those are always very, very well received. And certainly the fundraiser this year was also, I think, very popular. Nothing beats Dr. Hunt singing karaoke. I think a lot of people really enjoyed that, and the ability to sort of meet with other SSO leaders in a more relaxed setting so that people could network was very, very important.
Yes, if you didn't attend the fundraiser, you should talk to someone who did, and you will be amazed at the stories that they will tell you of how much fun it was. So
yeah, we're looking forward to your fundraiser, Dr. DiMatteo.
Yes, thanks. Well, again, thank you for all the work you did, and obviously the members of the committee that helped you, and the SSO staff obviously assisted in making it a great meeting. So thank you very much.
Thank you.